The Idaho Psychological Association presents Prescription Privilege for Idaho Psychologists. Idaho is at the bottom of all states in the Union for the number of psychiatrists per capita population. Even more worrisome, the number of psychiatrists is declining as they age out of the profession. New physicians are not replenishing the psychiatric ranks because the pay scale is so much lower than other medical specialties. What are the consequences? Both civilian and military facilities are having difficulty finding adequately trained mental health providers. Waiting lists, if appointments are even available, can be several months long. Medication follow-up can be inadequate. And the correctional system ends up being the mental health facility for far too many people who cannot otherwise find or afford treatment. Can't people other than psychiatrists prescribe mental health medicines? Yes. Mental health medications can be prescribed by pediatricians, family practice and other physicians, psychiatric nurse practitioners, and physician's assistants. In fact, 70 to 80% of all psychiatric medications in this country actually are prescribed by a non-psychiatric provider. What is their training? Physicians, including psychiatrists, usually have about 12 years of training, or approximately 20,000 hours. Only psychiatrists, but not other specialties, have training in doing psychotherapy. Nurse practitioners have 4 to 5 years past an undergraduate degree. Their programs do not train in psychotherapy. Physician's assistants have 2 years of training past a bachelor's degree. They have to be supervised. They do not have training in psychotherapy. Training doctoral level clinical psychologists to prescribe medications will help address the prescriber shortages and also will bring new skill sets to the mental health fields. Licensed clinical psychologists already have 5 to 7 years of training and anywhere from 2,000 to 4,000 hours of supervised clinical experience. To prescribe, they go on for 3 to 4 years of further training in psychopharmacology and pass an exam very similar to that required of physicians. This brings their training time to the same level as that of a psychiatrist, about 12 years or 20,000 hours. Is it safe? Yes. Psychologists have been prescribing in the military and public health service for over 20 years. They have been prescribing in Louisiana and New Mexico for a decade or more. There have been no serious adverse consequences. Prescribing psychologists are both safe and effective. What does the proposed Idaho licensing law say? Licensed doctors of psychology first earn a master's degree in psychopharmacology. They have supervised experiences, and they have to pass an exam similar to the one passed by physicians. Only then can they apply to prescribe in Idaho. Prescriptions are limited to medicines used in the mental health field, and every patient they see has to have a medical provider to evaluate any non-mental health conditions. The psychologist is required to collaborate with the medical provider or providers to ensure that the patient has comprehensive care. Prescribing psychologists are regulated by the Board of Psychology, which has an advisory committee comprised of representatives from psychiatry, psychology, pediatrics, and pharmacy. Oversight and discipline protect both the patient and the prescriber to ensure up-to-date practice. Yearly continuing education is required. Prescribing psychologists are bound by the same laws that regulate all other prescribing fields. Doesn't this just add to the emphasis on medication? No. Often it does the opposite. The license to prescribe is also a license to unprescribe. A recent study found that people who went to a mental health specialist were less likely to receive medication than if they went to their primary care physician. The specialist more frequently suggests therapy or other interventions and can better monitor medication. Prescription privilege for psychologists is safe, it is effective and proven. It will increase the number of providers and significantly increase the number of providers with advanced training in psychotherapy. It is collaborative to ensure that the patient receives comprehensive care at no cost to the state. Thank you so much for taking the time to listen to our presentation this morning. Any questions or comments can be sent to suefarb@aol.com or ipaoffice@idahopsych.org.